Hello, everyone. Welcome to our monthly seminar. I'm Dr. Harold Coney, and this month we have Jennifer Wortham, Dr. Jennifer Wortham. We are so thrilled to have her talking about a fascinating topic. Dr. Wortham holds the positions of Secretariat for the Global Collaborative, Managing Director for the Lean Institute, and Research Associate in the Human Flourishing Program at Harvard's Institute for Quantitative Social Science. Dr. Wortham has over 25 years of experience as an executive consultant for several leading healthcare organizations and public health agencies. She has received numerous awards for her work, including the American Hospital Association, Society for Health Strategy, and Market Development Circle of Distinction Award. Dr. Wortham earned her doctorate in public health, healthcare administration, and teaches graduate school at the UCLA Fielding School of Public Health. She is certified Lean Six Sigma Master Black Belt, so don't mess with her. And has extensive experience in the development and of high reliability, just culture, safety, and quality improvement programs in the healthcare sector. Now, I could go on and on. She has an extensive bio, but Dr. Wortham is truly an amazing person. She has brought together so many resources throughout the world to look at this area of childhood, negative experiences and moral injury. And I'm so excited to be working with her on these projects of hers. So I'm going to turn it over to Jennifer. And Jennifer, take it away and tell us more about who you are and what you do.
Thank you, Harold. Well, welcome everyone. And I can't see your face. I just put a shared screen. I can't see your faces. So give me a minute to figure out what I think because the chat box is open. I'll make sure I don't lose you there. Nope, don't leave the meeting. There we go. Okay, now I should be able to see. So thank you everyone for joining us. And if you hear dog barking, I have a little dog in a little loft here. So this is Jasper, everybody, just in case. He's my constant companion here. So thank you all for allowing me the opportunity to speak about this topic, which is of course near and dear to my heart. Unfortunately, all too tragic problem that we face in the world. And it's really something that I'm passionate about and looking to, let's see, I still can't see you guys on my screen. So let me give 1 second here and figure out what am I doing wrong. I was there a minute ago. Okay. Share screen. I should be able to do both at the same time and see you. Okay. Well, Harold, there, I think we're there. Okay. There we go. Now I can see you. So then I can see hands if anybody raises their hands. So I'm working with the Human Flourishing Program as a research associate at Harvard. And we are focused on several different domains of human flourishing. The aim of the program is to really look at the broad question of how knowledge from the quantitative social sciences can really be integrated with the humanities of human flourishing. And so how we can look at a synthesis of this knowledge across different disciplines. And so I'm really excited. I've joined about 1.5 years ago and have just made some amazing new friends and colleagues, and just very blessed to have this amazing opportunity. So the Human Flourishing Program, we have several core areas that we focus on: religious communities, spirituality and religion, and medicine and public health, and the theology of health, meaning and purpose, character and formation, which includes an element around forgiveness and the philosophy of character, work and well-being, and family and relationship. And one of the amazing things about this program is the cross-cultural and interdisciplinary work that we do, and also the bridges and partnerships we have with so many other academic institutions, including the work we're doing with Harold, which is just really an amazing experience. So my personal research focus, as they mentioned, high reliability organizational cultures. And people ask, well, what is that? It's really based on the fundamentals of how organizations can establish cultures of transparency and really to increase people's level of confidence, decrease their fear, so that you can address deficits or issues in systems and get them fixed. The concepts emerged out of the aviation industry and the nuclear power industry, and it's really an important framework in healthcare and public health. And now, as we're looking at applying these concepts to institutions to make sure that they're safe for children. The other work I'm focused on is the impact of religion and spirituality on health outcomes. And moral injury is very clearly tied and associated with my research interests. And I've been focusing this last year quite a bit of time on ACEs and especially on child sexual abuse. We last year held a symposium. We had about 1,900 people attend. And so it's unfortunately a very tragic issue across the world, and many people are realizing the detrimental impacts it's having, and we're focusing now more time and attention, which is really good. So today we're going to focus on moral injury. Moral injury, the term moral injury kind of started emerging in the literature. Jonathan Shea at the VA and was doing work with military personnel or veterans who had severe PTSD, and I would say complicated PTSD. They had issues with homelessness and addiction that just they weren't getting better. He noticed that there was a group of people that just, no matter what kind of treatment they did, they really weren't getting better. And he sat back and did a kind of a qualitative review, and found that many of them were struggling with some of the same issues of guilt and shame and betrayal. And Harold is much better versed in this part of the work than I am. And so Harold, do you want to mention just a little bit about some of that work the military did? And
well, since 2009, its moral injury has become much more the attention of mental health professionals because of the work of Jonathan Shea and his colleagues. And it's focused on the military. That's where it's kind of focused on, where it came out of in particular. But Jennifer, it's expanded to many other areas, from healthcare professionals during this COVID-19 pandemic to emergency responders, to clergy, to virtually everybody, because moral transgressions are so common and people suffer over them. So it's so exciting, naturally, the pathways that you are beginning to open up for adverse childhood experiences.
Thank you, Harold. Yes. All right, so I'm going to dive in. What is moral injury? We've been doing a little bit of work at Harvard on this the last couple of months, and integrating with the work that Harold and his team has done, and then others. And so moral injury is the presence of persistent distress following what we call a potentially morally injurious event, or a series of potentially morally injurious events. And a moral injury event is an experience that really threatens one's worldview. It ultimately really shakes their perception of their world. That includes their beliefs, their intuitions about right and wrong, good and evil, and even their sense of goodness of self and others. And ultimately, it also really impacts their sense of purpose and meaning. So examples, what we're focused on expanding is really those experiences that one has where they experience betrayal or abuse by a loved one, a parent, or an authority figure. Also, other examples of moral injury could include interpersonal violence, domestic abuse, rape, bullying. Typically, we look at issues around crime and war, especially the senseless killing and torture, which of course we know all war has senseless killing and torture, but there are different experiences where that goes beyond what any warrior would normally experience. Discrimination is now also, as we look at systemic discrimination, is becoming much more of a issue in moral injury, harassment, betrayal, and things like wrongful conviction. So those are just examples. Of course, there are many types of moral injury events, and I'm not sure, Harold, if you want to expand, if there's any others here that are missing or that you might want to comment on.
Well, I think you covered them very well, Jennifer. Those are the main ones.
Those are the main ones. Thank you. So one of the challenges of moral injury are the impacts of that it has on the individual from a physical, neurological, and psychological perspective. And there's several studies that have recently found associations with, of course, psychological and neurological disorders, physiological disorders, and then we often hear about the psychological distress that people exhibit around moral injuries. So they have high levels of anger and guilt and shame and sorrow and despair, interpersonal conflicts, and then things like sleep disruption and just really challenges throughout their lives. They're also experiencing extensive existential and spiritual issues. And so existential issues include feelings of isolation, having preoccupations with death or harm. They experience loss of meaning and identity. And I think one of the things that we see most often is they experience a loss of agency or a sense of agency. And that's especially prevalent among victims. And then the spiritual distress can include a loss of belief in God, their changes in their perception of God, and that potentially going from thinking God is benevolent to malevolent, having anger at God, and potentially feeling as though they are being punished by God. So these are all common things that are emerging in the literature. So the literature over the last, I would say, 10 to 12 years has really focused on the perpetrators and the witnesses, because much of the research has been done involving veterans and U.S. military. There is some literature that goes back prior to Jonathan Shea's work around healthcare ethical dilemmas and distress. And so that work kind of emerged in the 80s. And so much of the literature is focused on those populations of perpetrators and witnesses. But we also feel that moral injury impacts, of course, the people that are victimized by the perpetrators and the victim they may also have vicarious trauma. So it could be a family member of a victim. So we proposed developing 3 separate categories because we think the symptoms are unique to each category. There's common themes of shame and anger kind of throughout, but there may be higher sense of loss of one's sense of agency and purpose for victims. And there may be higher sense of guilt or shame among perpetrators. So we want to look at this further and try to really look at the unique characteristics so that appropriate treatment interventions can be developed. And when we think about the perpetrators, we really look at, it could be an individual or organization causing the direct infliction of a potentially morally injurious event. Essentially, we look at it, was it intentional or unintentional that this was committed? A witness or association, again, it could happen an individual or organization who bears some responsibility for failing to prevent or stop a potentially morally injurious event, or may have failed in their duty to protect someone. And when we think about institutions, we think about the individuals who make up the institutions or organizations. So for instance, my work mostly has evolved with my experience working with the Catholic Church and issues around clergy abuse. And so there are both individual culpabilities and responsibilities. There's leadership responsibilities. And then as you look at the institutions as a whole, they're starting to address their responsibility for creating an atmosphere that potentially could have contributed to clergy abuse. So that really comes around to looking at the entire systemic nature of moral injuries. So we're looking at these three types and just starting to delve deeper into how these are different and distinct, and what types of symptoms people might experience with each type of exposure. So I'll talk a little bit about adverse childhood experiences and moral injury. So we call in public health field, adverse childhood experiences are abuses that are highly traumatic and stressful events that generally occur in childhood from the time of birth until 17 years of age. So these types of events could be violence, abuse, or neglect. Witnessing violence in the home. So when the child is witnessing a parent being abused or a sibling being abused, having a family member attempt or die from suicide, parents or caregivers with substance use disorders or mental health problems, instability due to parental separation or loss of parent and caregivers, a household member being imprisoned, displacement, and food insecurity. So these are all examples of ACEs, and ACEs is being studied now extensively in the US in around 1998, 99. There was a very large study that was published from Kaiser and the CDC that correlated adverse childhood experiences with adverse health outcomes and mental health outcomes. And it was a significant correlation. And as a result, that has launched a lot of research into this field. So globally, it's estimated that there's about 1 billion children that have experienced physical, sexual, or emotional violence or neglect just in the past year. So this is a very prominent issue. The US Department of Health and Human Services finds that 1 in 7 children experience child abuse or neglect before their 18th birthday. And then just in the United States, there's over 1,000 youth are treated in emergency departments for physical assault-related injuries. And we have, unfortunately, 6 children die from abuse-related injuries each day. I didn't have time to go and look at all the statistics, and there's many countries that don't have databases, but the World Health Organization definitely has got a child abuse prevention in general, and violence is one of their main topics of focus. And so we also look at the problem of children being bullied, and that's becoming a more prevalent issue. And I will mention here, I didn't call it out specifically, but online abuse and exploitation of children is gone up about 1,000% just since COVID. So we have a lot of issues to worry about to take care of children. The impact of ACEs, as I mentioned, the Kaiser study, they found a significant association between ACEs, which are all commonly known as childhood stressors, and adverse health outcomes. So diabetes, hypertension, cardiovascular disease, stroke, and cancer, just to name a few. So it is a significant issue. There's a lot of research now that's going into looking also at systemic racism and discrimination as an early childhood stressor. So that work is emerging. It was not included in the original studies that Kaiser did with the CDC. ACEs are also associated with an increased risk for adverse mental health outcomes. A significant percent of adults experiencing PTSD and anxiety, depression, and substance use have a history of ACEs. I've seen numbers as high as 80% in some studies. People with an ACE score of 6 or higher are at risk of their lifespan being shortened by 20 years. And the risk of attempted suicide is increased by 1,200%. So ACEs are a significant issue and cause a lot of disability and anguish for people. And so why are these things happening? Well, when we look at what happens to children that experience adverse conditions, and it even can include food insecurity or housing or shelter insecurity, children that are displaced, refugees from war. What happens is these children experience chronic stress, and ultimately the stress leads to a constant state of stress that kind of turns on the brain, that they become hyper-focused on their surroundings, and the stress response becomes compromised over time. And ultimately, toxic stress really affects the brain, and including memory, selective attention, and also causes challenges with self-control and the ability for these children to turn off the stress response. So these physical and psychological traits can become embedded traits over time as the brain is developing, and that ends up impacting them over the entire lifespan. The challenge with stress and the impact that it has on the developing brain is that these deficits can then turn into challenges with their ability to cope, which actually causes more stress. So throughout the lifespan, these individuals experience a lot of anguish and a lot of challenges. And a lot of people don't realize that exposure to their adverse childhood experiences is really the cause of their ongoing stress, which is also a concern. So there's emerging research that has found moral injuries that are associated with both ACEs and negative mental health outcomes in adulthood, and particularly in trauma-related pathologies such as PTSD and depression. So I have a lot of statistics and data in here, and if anybody wants a specific quotation or reference, let me know, but I did include some of them here. So and most of these are very recent studies that I've seen in the last 3 to 4 years, even some in the last year. So we look at predisposing factors, including exposures to ACEs, that was suggested as a possible risk factor for moral injury related distress in military personnel. And approximately 24% of the UK armed forces report exposure to high levels of childhood adversity. And so that in and of itself places the military personnel at greater risk if they are exposed to a potentially morally injurious event during the course of their service. The likelihood that they'd have PTSD as a result of the event is higher. There's also a study examining combat-related trauma exposure in American military members, and found that troops that reported higher levels of ACEs ended up exhibiting higher levels of PTSD and depressive symptoms, even after they controlled for the contribution of the traumatic event itself. And then there was also a study that was done in Canada among public safety personnel, and they also found that there was a high association between adverse childhood experiences and moral injury, and higher rates of PTSD. So it's a very interesting body of literature that's emerging. I think, Carol, I'm not sure if you wanted to comment. You have a lot of experience working, of course, with these different types of studies.
Yeah, I agree with you that many of these studies are recent, because the concept of moral injury is really kind of on the cutting edge right now. And researchers are now beginning to pay attention to it, and funding for research in this area is beginning to emerge as well. So this is a critical topic today.
Thank you. So I've listed here different types of traumas that are associated with ACEs, and potentially who could be impacted from a moral injury perspective. So I'm not going to read all of these, but there's a long range of types of trauma. But something that's really important to note is that I think secondary and vicarious trauma is often underappreciated. And so the victim's siblings and parents and even their children can be exposed to moral injury when they learn of their family members' abuse. And so this is also something that's highly prevalent in healthcare workers and professionals, and even in public safety professionals. When you hear, and social workers are at risk, even clergy, when you hear of the serious or violent death or serious harm, and if it's related, especially to a moral issue, it can cause that individual also to experience moral distress and psychological trauma. And so there's a lot of different types of trauma that's experienced with ACEs and moral injury. So I'm going to present, this is the conceptual framework that I wanted to try to get everything that's happening into one kind of model. And so I did my best, because it's a very complex set of issues. And there's a lot of still unknowns, a lot of science and around different aspects of stress and how stress impacts the brain over time, how trauma and creates stress, and that ultimately leads to poor educational attainment. So what I'm trying to illustrate here is how all of this stuff is connected. And the little dots behind the graphics are the mediating and moderating environmental, social, and genetic factors. And so the interesting aspect of moral injury is that not everybody experiences the same moral injuries or has the same response to moral injuries because of the cultural context, because of their age. It could be their political affiliation. There's a lot of different things that can impact how someone perceives a moral injury. And then, of course, the strength of their spirituality, or there's the level of spirituality of formation, their religious affiliations. Do they have a supportive family member when they're growing up? The outcome could be based on the type of injury that occurred, the age of the individual, and the type of injury, whether it's sexual abuse or physical abuse. And then it can be compounded, as you saw, with multiple types of abuse. So ultimately, the relationships between all of those things, sometimes we have strong mitigating factors. If somebody has a very strong spiritual sense and they have support from their religious community, they may be protected against developing this kind of stress syndrome and going on to have higher levels of chronic disease and morbidity. What this is showing here is the relationships, and if we don't get people the treatment they need or the healing they need in terms of working with a member of their faith community, they can continue to spiral. And what we see in the studies, the recent studies that have come out in the last year or two, that ACEs are a risk factor for future moral injury. And so it appears as though there's something getting triggered and that is impacting people later in life. And so this illustration here is just an attempt to start to gather knowledge and information, and all the little dots really are all the variables that may impact the outcome of moral injury. And so there's opportunities for us to go and do deeper research, of course. One of the things that we found in the literature is that impaired trauma recovery is considered one of the possible mechanisms to explain the relationship between ACEs and adverse psychiatric symptoms in adulthood. Possible mechanisms that were noted in the literature are unresolved psychological and emotional consequences resulting from ACEs, and then emotional regulation difficulties. I think we can add easily to this list also unresolved spiritual and existential issues, but most of the studies put those into the psychological category. Despite consistent findings that ACEs are negatively impacting adult mental health, the studies exploring the mechanisms through which ACEs exert their effect are still limited. And so we need to do a lot more research in this area. We are launching an international ACEs moral injury study, our hope for 2023, provided we get funding. We're working with Harold and his team, and then a large group of children's hospitals that's part of the International Society for Pediatric Innovation. And they're very excited to support this work and feel that that moral injury has definitely been not well appreciated, and so we're going to be moving on and looking at this going forward. So just in summary, adverse childhood experiences are moral injuries that can significantly alter one's worldview and impact the child's spiritual formation and increase their risk for moral injury, both when they're children and throughout the lifespan. It can result in damage to the individual's spirituality, result in existential challenges, but it impacts the perpetrators, witnesses, and victims involved in these incidences. And so we can't not pay attention as well to the perpetrators and witnesses. And I will say, family members who maybe a parent who's been being domestically abused, it doesn't necessarily have the wherewithal or resources to protect their children at the time, but they may also experience a lifelong of anguish because of the impact that the abuse had on their children. Even if the children weren't directly abused, the environment can create problems for children. So that parent is both a victim, but they also feel a sense of responsibility and not protecting their children. So these are really complex issues that we need to address. Spirituality really, as we know, and research we've been doing here at Harvard, that it enhances resilience and serves as a protective factor against psychological distress and losses and moral injuries and hardships throughout the lifetime. And then unresolved spiritual trauma and the loss of resilience can have a devastating impact on one's mental and physical health and their well-being. It impacts their family members, it impacts their children, and can really have an also significant impact on communities. And then we look at psychological distress, which can lead to psychiatric disorders, and then toxic stress, which causes long-term health impacts. So, so there's a lot of concerns we have around this. So I have a list of references. I have many more. I just wanted to highlight some of the ones that I drew from in my work in the last few months. And with that, I would like to take questions and open it up for discussion.
Okay, so if anyone would like to ask a question or make a comment, please unmute yourself and feel free to do so. And Jennifer, go ahead and unshare your screen.
There we go.
I have a question for you, Jennifer, if I may. Or Daniel, you can go first if you want to.
Dr. Wertheim, first of all, can you put up your last screen or send your references by email?
I can.
They will be up on our PDF, Daniel. So all you got to do is go to our website and click on the slides PDF. You'll have everything.
Your website from Duke University, Spirituality?
Yes, Duke Spirituality, Theology, and Health. Just go to the website, Google it. It's the first thing that'll come up, and then click on the PDF and download it, print it out. You got them all.
Okay, thank you. My question is, has there been any correlation between a certain adverse effect and the illness that it develops from that adverse effect?
With ACEs?
Yes.
So ask the question, has there been an association between mental and physical?
Okay, let's put it this way. Let's deal with diabetes. A certain adverse childhood experience, say abuse by a parent or relative, does that lead to diabetes? Or does
Yes.
migraine headaches come from morally injuries? Is there any direct
I haven't seen any of it. I haven't seen any information on migraine headaches, but what there has been is strong correlation with the Kaiser study. They looked at 17,000 medical records. And
Yes.
what they found was they found much higher rates of diabetes, hypertension, obesity, cancer. When you think about anything that's related to potentially stress, stress, of course, impacts the immune system. It causes inflammation. It causes a lot of mental health challenges over the lifespan. So if you're interested, there's a lot of information. If you go in and click on Google ACEs Kaiser CDC study, you're going to get like 10,000 results. It's profound.
Okay, thank you very much.
Can I
Sue?
just, okay, yeah.
I saw Sue's hand. We'll come to you next, Tobias. Sue?
Oh, look, thank you so much for that talk. I'm just so encouraged. It's absolutely amazing, the work that you've done and you're doing, and what Dr. Kay's been doing. I feel really quite excited. I'd like to ask you, have you done much research in the correlation of reconciliation, forgiveness, and the healing process? Because I've found in my own life from childhood trauma, it's been my faith in God and having the ability to truly forgive the perpetrators that have enabled me to move forward, and which is why I'm so passionate about this area of bringing God and the spiritual aspect into the mental health equation.
Well, I will, you obviously you shared in your vulnerability. I too have experienced traumatic childhood. My ACEs score is 7, which caused a lot of anxiety when I learned that just in and of itself. And I went into this field because my brothers are both clergy abuse survivors, and I stumbled upon I was looking for research and literature on spiritual injuries that impact survivors of sexual abuse, and there wasn't a lot of information. And so I was able to kind of make my way over to this concept around moral injury. And to me, it was kind of like the Holy Grail. It was like all of Harold's work and the work that they're doing in this area, and especially in the Military and Veterans Administration, it just turned off all these lights and my brain went on fire. And I think that it's so closely affiliated with spirituality and forgiveness, but as you saw in the research, it's just a lot of people don't even realize that the distress they're feeling today is related to their childhood experiences. So we have work to do to educate the public, to let them know there is help, and to address and hopefully help resolve issues around adversity. And I agree 100% that the spirituality and my faith is really what helped me through my work. So.
Thank you. And do you see that forgiveness is an important factor in that?
Very much so. Yeah. And we actually have a partnership. We have an initiative at Harvard. We're working on forgiveness with Everett Worthington. And so if you link onto our website too, there's a whole body of work around forgiveness. He developed a evidence-based methodology called the Path to Reach Forgiveness. And I know Harold's consulted on that as well. So it's profound, and it's very important to add.
Thank you very much. I appreciate that. Thank you. God bless you.
Bias, I think you were next.
Yeah, thank you very much, Jennifer, for a very inspiring and motivational presentation. I'm Tobias. I'm a medical doctor and a PhD student from the University of Southern Denmark, but I'm currently a research fellow at the Harvard Human Flourishing program, actually. So I'm visiting. But I was just wondering if you could add some comments on if you know what kind of characteristics are relevant when considering that some PMIs, so like that potentially morally injurious events, go on to become moral injuries and some doesn't. So obviously, I guess we cannot remove evil from the world, right? There will obviously continue to be sort of potentially morally injurious events. But how can we work with understanding what contributes to these events actually becoming morally injurious?
Well, I think any betrayal or abuse, oppression could result in a moral injury. I think it goes deep into the sense of betrayal and loss of agency one experiences. Also, the context in which the abuse happens, and really the supportive care that they may have following such an event. Certainly, for example, what's going on in Ukraine right now, where children are being displaced, and it's a kind of a horrifying ordeal for a child to be ripped from their home and moved to a place. But the potential for mitigation of the moral injury is the love and support they receive by those who are taking in refugees and providing support, and then the parental support around caring for the child and explaining the situation. And then certainly religious and communities can provide a tremendous amount of support. And so the events may happen, but whether a moral injury is manifested from that, it really depends on all these other elements. And we don't have a lot of research to demonstrate that. That's what we want to go into doing now. Some of the work that I'm looking at with this group on the pediatric and the ACEs is there was a big study that was done following the earthquake in Palermo and Italy, and the many children that suffered and were traumatized, and they expected to find high levels of PTSD in that population. So they've been doing a longitudinal study, and they're not finding high levels of PTSD because they feel that the communities and the social support and religious support potentially may have mitigated the development of PTSD. So we're going to be looking at that, and they were very, very excited about participating in this work and looking at what are the factors most associated with the manifestation of a moral injury following an event. So, Harold, did you want to comment? You have probably even more in-depth experience on this one. So
No, I think you covered it very well. I think Jenny has been waiting to ask a question here. So I'm gonna...
okay, she's next.
Thank
Okay.
you. Thank you very much. I'm Jenny McLaurin. I'm a pediatrician and have a theology and ethics degree as well, and work nationally with community health centers. And we've been working with them on moral injury this year. I'm not a researcher, but I use the research. And, healthcare workers are really suffering. And the more I learn about this, the more I see how it's been reflected in my own journey in healthcare and the moral injury that I've experienced. And what I'm wondering is are there preventive ways or ways that we could educate beginning medical students and residents and people who are going to go into healthcare on screening for this, and also doing something to help them be aware at the prevention end, because I find that most of this happens at the accumulation end instead of the prevention.
Exactly. Yeah, so we're working on actually, as we speak, we're working on putting together what we would call early detection and healing guides. Harold and his team did an extensive amount of work with the Veterans Administration to help with healing and then now prevention, and working with clergy on ways they can mitigate any moral injury that people might encounter. So we actually are focusing on healthcare workers first, because we believe if we take care of healthcare workers and have them understand moral injury, then they can actually be better positioned to help others. So we are hoping. We're working over the summer. We're working with a number of clergy, and anybody on this call who's interested in working with us, please let me know. We're putting lots of teams together. We don't have, this is not really funded, when people are just adding to their time because it's such a critical issue. You're hired.
One other thing is it's a systemic problem.
It is.
We direct moral injury to the individual healthcare worker for resilience. We need to change the way we do healthcare delivery, and that's a systemic problem. So thank you.
Yes, yeah. So we'll definitely include you on our panels, and what we want to do is we want to be able to get these tools available through a portal. So we're looking at developing a whole interactive application and moral injury, taking the moral injury assessment work that Harold and his team has done and making it available to people. But we rather than just doing assessments, we also want to make sure that there's some interventions for them. And we certainly see working within a faith community, even in America, where we have now such a large body of people that are what we call nuns, who are not Catholic nuns, but nuns that are not really affiliated with a religious institution or faith tradition, who are a little bit kind of, I call them spiritual wanderers. They're just kind of not really rooted in one type of spirituality. So we are going to be attempting to provide some resources, spiritual and existential support. So it's a very exciting project, and I've got lots of people saying they want to help. So I'll make sure that Harold gets the email out, and Harold and I will be working closely on this over the next several months. So please join us if you're able.
Excellent. I believe that Michelle Hurley is next. Michelle?
Okay.
Hi, my name is Michelle Hurley. I'm a physician turned chaplain, and I provide spiritual care and teach medical students here at a hospital in New York City. My question is, what role do you see spiritual care departments and chaplains in addressing these issues?
So we think that they can have the biggest impact, and certainly chaplains are usually dealing with an acute problem in the hospital, and end of life situations, and at that time people are really trying to resolve and address moral injuries. The first thing we want to do is we want to make sure that they have good education and that they're well informed on the relationship between these issues and mental health issues, and so that they can identify if there's something that's going to be needing more than a spiritual director or clergy intervention, if there's going to be some help needed with a mental health professional. But certainly, many times people, when they're in distress, the first person they'll go to is somebody in a faith community. So we also want to make sure that they are well informed from a trauma perspective and understand trauma-informed care and the best approaches to dealing with moral injury. And so we're working on a guide, as I said, and it's going to be for faith tradition specific, and it'll be centered around shame and betrayal and anger and self-condemnation, and leveraging a lot of the work that's already been done, but to really get those resources out into the community so that the community, faith leaders and clergy and chaplains can access this work. But they play, I think, an essential role in helping people overcome and address moral injury. Harold, I know you've done a ton of work in this area, working with chaplains. Did you want to comment on that?
I think chaplains are one of the best people, the best professional to be addressing many of these moral injury concerns, simply because, religious organizations have throughout history done that. They have things in place. They have had things in place to help returning warriors, as well as other people undergoing trauma, and through procedures that have been around for thousands of years. So clergy play a critical role. Now, Matthew, I believe, has a question. Matthew Fugate.
Yeah, I think you hit on this a little bit, but I was wondering if you might be able to point me to any research that specifically correlates moral injury with maladaptive spiritual coping patterns, if that's something that has been explored in depth, or is the research still trying to kind of get into exactly what the correlations might be there?
So I know Harold's the senior author in many of these, or has reviewed many of these studies. There is, and I think when you're talking about maladaptive spiritual, are you looking at people that have questions about God, or thinking that God is punishing them, or is that what you're thinking?
Yeah. Yes, those sort of thoughts or behaviors. Yes.
Yes, so there is some research in that, and what I'll do is I have like probably 50 or 60 or 70 different resources on moral injury, and then I have others on ACEs. So I'll put together, I have everything in it, kind of a OneDrive. And so if people want to email me, I'll send you a link to the OneDrive, and you can just follow it as we add research in there. And I may be able to get a student to kind of categorize them, because the body of literature is growing quickly, and I don't want you to have to read all of them, but we'll be happy to do that.
Yeah, Joseph Currier at the University of Southern Alabama has done quite a bit of work on spiritual struggles and moral injury. And, one of the symptoms of moral injury is having spiritual struggles or negative religious coping. Okay, so I believe that Christina was next. Christina, why don't you unmute yourself and ask your question to Jennifer?
Thank you so much. Can you hear me?
We can hear you.
Good. Yes, I'm faculty at Azusa Pacific University. I teach bioethics and healthcare policy. And I don't know about anyone else, but the students I teach are nurses actually in practice. So I've been listening to them for the last 2 years, and I feel like I have vicarious trauma as a result of listening to what they've gone through, and just moral outrage that our healthcare system is so dysfunctional that it allowed what to occur. So that's just a bit of transparency on my part. A good friend of mine, Dr. Richard Baget, I don't know if anybody knows Dick Baget, but he's been working with moral injury and with people who have suffered extreme trauma. He was in Africa, is now back in the United States. But he mentioned one time that one factor that he has heard makes a difference is the sacramental rituals that a person can go through to help them unburden themselves from the guilt, and that these people don't necessarily need to be part of that faith community, but to be there as part of a ritual. It made a huge difference. So I don't know if anyone else has heard that, and so it just brings the point of how a faith tradition and a community can help facilitate more deeper healing.
I agree. I think that's a really great sharing. Thank you. Thank you.
Yeah, confession and absolution, and then penance is the core of many of the treatments right now, the chaplain interventions, clergy interventions for moral injury. So those are central core concepts in the treatment. I believe Glenn is next. Glenn? Unmute yourself. Go ahead.
More of a comment than a question. I've been in public health for, 30, 40 years now. And Harold and I actually first met each other working with the Special Operations Chaplains. And I just want to say I am so impressed and excited to see spirituality and psychology merging again, I should say. And I think it's so significant that the work you're doing, Jennifer, is at Harvard. I also noted Arthur Brooks. Have you come across him at Harvard?
Not yet. I'm still new. I'm learning. It's for
years, but it's just so interesting that he's
who is it?
Arthur Brooks. He's written a lot about what makes people happy and a lot of spiritual undertones there. I've worked with resilience for years and interviewed World War II survivors, and one of my conclusions was their spirituality is what helped them return from combat intact. So I just think it's so encouraging after so many years of waiting and wondering why are we not pulling in the spirituality into resilience and what helps people cope. So thank you what you're doing. Harold, thank you so much for spearheading this movement, gathering the spiritual research over all the years. It's just it's been a real blessing to see that come together so we can now talk from the data and not just from opinions.
Yeah, I could do a whole talk just on the lack of spiritual integration in the field. There are a lot of reasons for it, but as I've talked, just without doing a full research project, talked to friends in mental health. They don't get any training in spirituality. And then when we think about the complexities of the different faith traditions, and somebody who may have grown up Catholic and then be exploring Buddhism and other things, it's a lot for somebody to understand. So our aim is to try to get tools and resources into their hands so that they can provide support, and then ultimately we'd like to see multidisciplinary teams where the spiritual leader is part of a broader team that's helping to support people through their trauma. So
Yeah. Glenn is a major figure there. I believe at the University of Pennsylvania, that you run a center there also and done some incredible work.
It was actually University of Maryland where we tested out some resilience training, coping skills, and now I work with the veterans and firefighters and cops and trying to preventively equip them. And I just wrote a book actually on adverse childhood experience. So what you're saying is really relevant to me because I think the shame and the guilt. My wife and I also run an addiction recovery faith-based group, and the guilt just gets ingrained. It's very hard to uproot, and so the spirituality is such a important part. I always think of what Harold wrote, that religion causes guilt, but it also is an answer to guilt, a solution to guilt. And I think the data is showing that. Thank you, Harold, for showing that too.
Thank you, Glenn. I believe Meryl is next. Meryl, go ahead and ask your question.
Thank you. I am a rabbi and a geriatric chaplain in long-term care. And my question really is when I meet someone who has rejected spirituality entirely, is there a way in for them, especially knowing that there's trauma in their history? Is there anything like that opens the door?
I'm sorry, can you articulate one more time for me? It is, you said open the door for them to get help. Is that what you're looking at?
Not for them to get help, to open the conversation around spirituality. Like, I don't believe in God. I'm not spiritual. You know, how do you open the conversation with someone who is just that rejecting of all these things that we know can help and can be grounding and can help them walk their path?
You might start with some of the existential questions. There's some really good work, existentialists have developed like a set of 5 to 7 common, like the top questions around addressing, well, are they fearing death? Is it a loss of meaning? And you might start with that exploration. There are actually some tools and instruments that you can use to help give you some insight into what they're thinking and why they might be afraid of death, and then trying to explore that. That might be a way to get involved. I know there's probably some really good psychologists. Thank you, Sally. I see Sally has to leave. But there might be some other interventions. Like Harold, what would you say? I mean, you're a psychiatrist, and what advice would you give?
Yeah, it's tough. It's tough. It's difficult. The one thing you don't want to do, and I've made this mistake, so this is from experience, you don't want to push it on them. You do not want to push spirituality on the person. You want to listen, you want to find out where they are, and you want to love them where they are, and then walk with them. That's all you can do. It's really all you can do.
I think that accompaniment is really important. I really do. And over time, that opens up the opportunity for them to feel somebody's there to support them. But you might just start off with that accompaniment and just say, well, I'm here for you. And let me know anytime you need to talk. And they may be willing to explore it from there. Brendan, you had a question?
Brendan.
Yeah. I was just wondering, are there some really studies focused on specific religious beliefs and practices? So not just a general kind of spirituality is good for health, but are these studies focused on really specific religious beliefs and specific religious practices and the therapeutic value? And I mean, for instance, it was good to hear Harold speaking about confession, absolution, being good for the soul, good for health. So really just bearing down on and so, studies that bear down on specific religious beliefs and practices, but there's a focus there for maybe integrating them into clinical practice, healthcare practice. And I mean, I found that the tradition of hospitality, the monastic guest house, is a wonderful way of delivering that. It's an accompaniment tradition and spirituality. I just think that's tried and tested. I think there's no better way of delivering these things within health and social care. But it'd be nice to get some studies just to give a little bit more flesh out and give some of the specific beliefs and practices some teeth, I don't know.
Yeah, so there's a lot of literature on different religion and spirituality practices and integration to mental health. I think we need to do more research in trying to identify what specific things happen. But I can send you some research. It's a really good book chapter on transcendence and everything from music to the communion of practice. Working people praying together. So there are just in our human flourishing program research and attendance, religious service attendance actually has a significant impact on mental health outcomes.
Yeah. Well, I think it's important because I think there's a tradition there. Like I say, I'm very interested in tradition of hospitality, the monastic guest house, which is tried and tested. It's packed with doctrinal beliefs and practices, and it'd be lovely to see this integrated in possibly into health and social care. There's a lot already there. It's just anyway. Anyway, thank you for your talk.
Welcome. Before we lose everyone, we are planning a large conference on this in May, likely to be in Dubai. And Duke and Harvard and several other universities actually are starting to come together around this. So again, if you're interested, we may set up some kind of community of practice around this where we can actually have a monthly call and just talk about research and keep this conversation going. So anybody, please feel free to email me, and you can find me on the Harvard website. You can find me through Harold. Although please don't inundate his email box. I know he's got a long one, but happy to get you engaged in some of this work. And then the conference that we have coming up, which I think we'll be able to go into these really in much greater detail. So thank you.
Well,
and
we're going to have
top of there. I'm happy to stay. I can stay as long as you want. So.
Well, we are going to probably need to end. Gosh,
Okay.
Jennifer, wow, what a presentation and discussion. The fact that you left all that time for discussion, you saw the richness and the interest of everyone on this call. And there are like almost 40 comments in the chat that we haven't had time to address, but thank you so much for just a brilliant presentation, and thank all of you too for participating and asking your questions. And so we'll see you all next month. God bless and stay safe.
Thank you. Thanks, everyone.